What an important topic. Arthritis does not discriminate. Well, I'm waiting for a few of you guys to join live, but I have to tell you, I'm so excited about this topic. Uh, Most of us are not getting any younger, and that word arthritis is most often something that we are all kind of wondering what's going on. When is it going to happen? How does it happen? What exactly is arthritis? Can it be prevented? Do I get pain for the rest of my life when I hear that I have this arthritis in my body? So I'm very interested in that subject, like all of you, because I'd like to be as pain free as I can for the longest I can, and I want to be able to take the right steps. So, who better to help us with that subject than Dr. PJ Kelly? Dr. Kelly, who is our Chief Medical Officer, who's been involved in chiropractic, in healing, and working in sports medicine, in so many areas of overall health that I'm really, really excited to bring Dr. Kelly on board to really cover the subject of arthritis. Well, as many of you know, we as Elite Science, One TDC works so well. We have a lot of products for the pets, but we actually have some products for you folks as well on the human side. So as you look down below, you'll see the really pretty amazing offer that we did to help you guys promote healthy inflammatory responses for you as the supplement. So look down there, you'll see the code STRONG15. You get 15% off once you have the bundle of four 90 count one TDC. Plus, you get a free cream. You can't beat this. So, pretty excited to have you guys take advantage of that. But let's go with the subject at hand and really start tackling and talking about arthritis. So, let me bring the expert, Dr. PJ Kelly. Dr. Kelly, oh, here he is. Dr. Kelly, thanks for joining us today.
Hey, Olivia, how you doing?
Pretty good. I'm really excited for you to really give your wisdom around that subject because there's so many articles written about this. There's so many questions that people have. I mean, there's a whole science of rheumatology. There's lots of research that's out there, but kind of like going into the bottom line. Um, and frankly, you've been dealing with this for years in your practice and working with your patients. So
Yeah,
I'm
over
really
20
looking.
years, yeah.
20 plus years, yeah.
Yeah.
So we're pretty excited to hear about your experience with it. And if you are joining in, please don't hesitate to ask questions. We'll do our best also to cover that live. And if you're seeing this on Facebook as a replay, or if you're in the YouTube channel, please put your questions in the comments and we'll be happy to do our best to answer that for you. All right, Dr. Kelly, let's get right into this. What in the world is arthritis? What exactly is arthritis?
Simply put, arthritis is inflammation in one or more of our joints in our body. Pretty straightforward.
So one, so it's an inflamed joint.
It's an
Bottom line.
inflamed, absolutely.
Okay. So it doesn't have to be two of them. Just one of them will
Be one.
qualify. Only
Yeah,
one.
and I think
Okay.
we'll get hints further down the road here of why that it could only be one joint or more.
Okay. All right. So now that we understand the very simple definition that arthritis is basically an inflammation of joint, one or two, obviously everyone is wondering the same question: is okay, great, but what exactly causes inflammation or that arthritis?
Well, there's lots of causes. It could be an autoimmune disorder such as rheumatoid arthritis, which that's a bad disease. It could be
Mm.
osteoarthritis. It could be metabolic from something like gout as gouty arthritis, infections, obesity. There's lots of things that can help cause arthritis. Not
Got it.
one
So
single cause.
not one single cause. So to your point, you just covered that there are different types. Um, is there anything on the onset, like you talked about rheumatoid arthritis? Is there something specific to the onset of rheumatoid versus diabetes? And how are they different from the impact on the joints themselves? Pain level or maybe deterioration of the joints? Is there any nuance between those and, to determine which is which actually?
Very much so. Um, Osteoarthritis would be your run-of-the-mill arthritis that people associate with aging. Rheumatoid, again, is an autoimmune disorder. That means your body is attacking your own joints, and your body can't differentiate that it shouldn't be attacking your joints and cartilage, and there would be numerous differences. The main one being the pain level, the swelling, the redness, joint deformity. These are people you're typically going to see with like ulnar deviation, like their fingers literally just start bending
Yes.
away. So severe joint deformity, that the joints actually can start to actually fuse. That's a bad disease, and there's a lot of genetic components to that as well. For what we're talking about, the bulk of what I'm helping people deal with is the osteoarthritis.
Osteoarthritis. Okay, got it. So
Not,
let's talk about the. So go ahead.
I was going to say, not that there's things we can't help with a disease like rheumatoid arthritis, but we're focusing on the run-of-the-mill because that's what most people are going to get at some point.
Yeah, no, got it. But whether or not it's rheumatoid arthritis, deformation, osteoarthritis, the commonality with them from a joint standpoint is the inflammation is present, yeah, in the body's response to it. So, but let's talk about that. So, what are, because everybody's like, for example, I had my big toe that I had this excruciating pain the other day, and I'm like, oh, is that the beginning of arthritis in there? What happens? And I'm kind of wondering. So, aside from that little episode of wondering what happened to my toe and then it went away, so and it didn't come back. So I figured probably it's not arthritis. But so what are the symptoms? How do I know and do a little self-recognition that perhaps this might be arthritis and I should do something about it?
So first and foremost, the patient's going to experience stiffness in the morning that gradually gets better as they move around.
Okay.
And you're going to have stiffness in the joints. You're also going to have, you could have a limited range of motion. You're obviously going to have pain. You can have redness, swelling, all of the above. That's the inflammatory response. It's not much different than if you twisted your ankle. Beyond the fact that typically in the beginning, it's the, what's that ache? And then it goes away as the day goes on.
Got it. If you just joined us, thanks for joining live here. We are live with Dr. Kelly, who's an expert when it comes to orthopedic and chiropractic and doing a lot of work with aging patients, all kinds of ranges, including fitness as well. And I brought him on the show today to really talk about arthritis. So thanks for joining. If you've got questions about arthritis beyond what we're covering, we'll keep an eye on that in the notes and make sure that we can respond for that as well. So, all right, Dr. Kelly, let's go into, we've talked about the symptoms. Now, what I'd love to go into more is what you do, or your colleagues as well, is how exactly do you diagnose? What is a healthy looking, bad looking? How does that all work? How do you diagnose it?
Pretty simply, from a history, a person comes in and depending on what their age is, what their activity level is, how the pain feels, you can get a lot of it from just knowing the description that the patient gives you, their subjective complaint. But truly, the real diagnosis comes from blood work, imaging. We're talking X-rays, CTs. Okay. Those are the kind of things that you use to diagnose it. Like, for instance, the blood work would come in handy for a person with rheumatoid arthritis. You'd be looking for RH factors and doing a rheumatoid panel on that person if that's what you suspected. You don't do that on every single person, of course. But yeah, those are the typical ways we diagnose it definitively.
Got it. So X-ray, blood work, and I guess you guys are looking for C-reactive protein, or what is there any, or there's a specific panel?
Well, the rheumatoid panel is blood work. If you're getting into some of the metabolic or autoimmunes, you're doing that blood work. Typically, I would not do a blood panel on somebody that I suspected to have osteoarthritis. And truthfully, I wouldn't go and do an X-ray on somebody that I suspected had osteoarthritis. Okay. You know, and then as a treatment protocol, like for MRIs, for instance, you just don't do an MRI. If I truly think somebody needs an MRI, well, they're not going to get it for several weeks because the insurance companies won't prove it. So I always explain it as we could do an MRI today if the insurance companies allowed it, but what information would it give us beyond what I already suspect from my physical exam? I think you have a disc issue, so why do I need an MRI to prove that when I could treat you conservatively for 2 weeks and you're 60% better? We obviously do not need that MRI. My diagnosis from the exam was correct, and we will continue on until we resolve it. Where that stuff comes into play is you aren't getting better. Why aren't you getting better? Am I missing something? That's when x-rays come in. But somebody comes in, I think they have arthritis or an actual injury that arthritis is compounding, then I'm not doing an x-ray that day. I'm going to wait and see how the conservative care does, and we go from there.
Got it. Well, do you want to maybe show us? I know we've got some images too that we can show the audience. Kind of wondering what's normal, what's not normal, what's impacting it. Once you've diagnosed it, or to your point, sometimes, I mean, from experience, based on the type of pain or what you're sensing already in the body mechanics, what would you, can you show us, or can we understand what's normal and what's abnormal?
We can look at some normal x-rays. We can look at some abnormal x-rays. But the bigger point that I think is the crux of what I want to get across to the people out there, and what I try to get across to my patients is it old age? Is it overuse? We hear that a lot. Oh yeah, I got some arthritis in my wrist. I worked in the assembly line, and I overused it. And my response to that is, I do not put much credence in the fact that you're old, so you must have arthritis. I don't put much credence in the fact that overuse causes it. Okay. So very simply, for the age part of it, and this is, I love showing the x-rays because it's just a no-brainer. It's so easy to see how age can affect or cannot affect arthritis. So with that being said, let's look at the normal x-ray.
Okay. Let's put this in.
This is of the cervical spine. This is your neck. So what you can see is the front of the square bones, which would be the vertebra. They curve forward, and you can see to the right here that Olivier has highlighted that curvature. That is what a normal spine looks like. That is proper biomechanics, okay? That's how the spine should move and work, from that static posture right there. So what happens when the biomechanics go bad? Let's look at the reversal. So when you're looking at these up close, you see the normal. You still see that curvature forward. If you look at the one on the right, you can actually see that cervical spine. I always look at the front of the spine, the front of the actual vertebra. That gives you a better contiguous line. You can see that one's actually reversed. But there's no arthritis. It looks fine. That is what the cervical vertebra should look. There's no distortion. There's no bone spurs. There's no decrease in disc height. It's just reversed. So that is the first step. That is poor biomechanics. The body was not designed to work in that fashion. So if you're going to use your body from that bad biomechanical standpoint, you're going to wear out faster. Okay? So with that being said, let's look at what happens when you use improper biomechanics.
Get that image for us. But just before you go there, so that curvature that reversed, that in itself could happen, and you could technically not have arthritis, although it's probably going to lead to it. But that's just a bad posture, bad movements over time. I would think a lot of kids now with their cell phone is probably accelerating that process.
Yeah, there's a name for it now. We all know text neck.
Text neck.
That's a real thing. And when you look down like this all the time, in fact, I every single patient that comes in with neck pain, I pick up my phone and I do this thing. I don't know if you can actually see it, but I hold this. So I have my phone. I look straight down like this. And this person's holding their phone right against their chest or belly, and it is a horrible, horrible posture. And I always say, take this arm, put it across your belly, put it right there. Can you see the difference in the position of my neck? And I'm still doing the same thing.
So wait,
Burning my brain on screen time.
Yeah, wait, so what you were saying is when you're going down like this versus moving up the phone, maybe holding it, then also even that slight movement of holding it allows you, like I'm in New York City, so we're in the subway a lot, and guess what? Everybody's on their phone. But you're right, most people are not doing that. We're all looking
Look
down.
straight
like
down,
this.
yeah. It's comfortable to just have the phone resting against your belly. Yeah. Put it across your, just very simply across your like this and just go like that. And now put your phone at head height. That's just one simple way to change a pattern. Like when my kids were growing up, they're 9 and soon to be 11 next week. They knew that if I had to tell them twice about looking down at their screen, they lost it. So they adapted really quick. They would lay on their belly, and so now they're looking up. They're promoting a good curve, or they sit backwards on the couch and they put it on the back of the couch. So they're looking. They always try to put it head height. They stack pillows up on the couch. So they made adaptations, and we'll talk about adaptations and the positive effects that can actually have.
Got it. So you've shown us a normal curve. I'll bring it back again. So that's your normal curve here that we see. Then you showed us what happens when that normal curve, not that it's just cell phones overall, but we are constantly looking down, and that causes that reversal of the spine, which then, as you explained, can lead to problems and obviously arthritis. Now, let's take a look at what arthritis actually looks like. So let me bring this on the screen and let you cover that for us.
So it was one of the things I always loved going over x-rays with patients because, again, people really think old age is causing arthritis. But what's so profound about this specific x-ray, within that yellow box, you see horrible degeneration. If you compare the previous vertebrae or the ones that are above or below that, there's no bone spurs. There's none of those decreased disc height that you see on here, narrow disc space. That's arthritis. That is exactly what happens when our body becomes arthritic, our joint becomes arthritic over time. The key is that's over time. That doesn't happen overnight. That is many, many years of poor biomechanics and inflammatory states. So if age was purely the cause for that arthritis, we go 1.5 inches, 2 inches upward, there's no arthritis there. Why did that forget to get old? So in my opinion, that's why I do not put much credence in the fact that old age is going to cause arthritis. I do tell my patients, if you live long enough, you're going to get it, but it's not because you lived long enough. It's the patterns and the biomechanics that we talk about.
So what you're saying, this is huge because there is that perspective that, either something genetically happens, you talk about rheumatoid and so forth, but there's this conception in our mind, at least in my mind, that I'm getting older, I'm getting arthritis, or it's almost, you start watching the decades where you're getting older, it's like, oh, when is that going to happen? But what you're saying is, and I love this picture, you're right, because the part that's compressed vertebra or in the neck here is above, it's looking fine. So why is it here? Basically, what's caused this? Is it a time bomb that's biomechanical or genetics, or what exactly happened? And more importantly, how can we start worrying about preventing it?
Okay, so overuse, old age, those are the two old adages that people assimilate arthritis to. So we talked about the old age. That's fine to not age contiguously. So obviously there's more to it than just old age. Overuse, a lot of people think overuse causes it. I always give the example of world-class runners. If overuse caused arthritis, every world-class runner on the planet would be in a wheelchair. They're using their ankles, knees, hips more than all of us.
Yeah, true.
And they're usually in better shape for a longer period of time, as long as they're taking care of themselves while they're doing that. So overuse, how does that contribute? Is it a contributing factor? Overuse is a contributing factor. So if you had the perfect cervical curve and you overuse that, you will have much less wear and tear than the person who had the reversal. So that is going to accelerate the neck wearing out or arthritis exponentially. So bad biomechanics, we weren't designed to have our neck be reversed in a normal static posture. So it is compensating and working in a way it wasn't supposed to. Much like our cars, if you don't get an alignment of your tires, you can wear those things out so fast and so weird. We all experience that. I'd be hard pressed to find a person who didn't have their tires wear funny and had to purchase them prematurely, and it was because their car was out of alignment. That is what happens to us.
It's true.
If we are not lined up and working the way we were biomechanically meant to work, we will wear out faster. And there's a perfect example of a tire that
I got to show that. Let me show that on the screen, because I think this is a really good example of what you're illustrating, because it's true. I think all of us who drive a car have experienced that, where you got those nice looking tires and then they're wearing out a certain way and you're kind of wondering what in the world happened. Let me show that.
Yeah, you look at the outer edge of that tire, it's bald. Rest of the tire is, it's not bald. So there was something causing that part of the tire to wear prematurely. And that's exactly how overuse comes into play with bad biomechanics. So that car was misaligned, that tire wore out prematurely.
So, Dr. Kelly, let me just make sure I understand this correctly. So you're saying that it's not necessarily because I'm getting older. It's not necessarily because I do a lot of exercise, a lot of activity, or like you said, overuse, that I'm going to get arthritis faster, or not at all, but it could be much later. So it's not an accelerator per se. But what you're saying is the key thing is the alignment of those bones during the use or through a lifespan is going to create this inflammation or this friction or this resistance in a way that it's not meant to be, to where it's kind of like the tire, because it's misaligned and it's being used, that it's going to create a response of inflammation, and then whatever transcends after that into the body. Is that kind of the gist of what I'm understanding?
Yeah, absolutely. Easy way to look at it too is we've probably all have a loved one or yourself that has had a knee replacement. When they do those knee replacements, it's because there's bone on bone. There's no cartilage left. And you look at those x-rays, it is not the entire cartilage is gone and everything's symmetrically lined up. These people have no cartilage on one side because that joint is it's just malaligned. There's more pressure, whether it be from an injury and or biomechanics. Fallen arch changes the whole mechanics of the rest of our body.
Okay, so now that you've mentioned that, and I think that this is huge, because we've always heard having good posture and good body mechanics is important. What you're saying is it's not just a luxury; it's a prevention of potential pain. Is what you're saying, and deterioration of your body mechanic structure. So, okay, so the most important question that I think everyone wants to know is, are there treatments for it? In your practice, how do you manage that?
Yeah, there's lots of treatments. I'm a huge fan of exhausting conservative care without side effects as those fail, and at times they do, escalating to more invasive or treatments that have more side effects appropriately. So, hey, diet, exercise, lifestyle, hydration, that goes a long way. Beyond that, you have chiropractic care, which is what I do. I tell people I'm your mechanic. My job is to get you working as close to biomechanically perfect as possible. And sometimes that's not the case. Sometimes you have an injury that your biomechanics are forever changed. Say you had a fracture and one leg shorter from that fracture. No, I can't make you biomechanically perfect anymore. The goal then becomes is how do we minimize what we just talked about? How do we minimize that bad biomechanics over time? For that person, maybe it's a heel lift if it was a traumatic thing and it happened right away and you can correct that. We helped correct that. We overcame that. If it's a job that you do that is poor biomechanics and you have no way to change that, I'm guilty of that. I'm right-handed. I stand on the left side of the patient. I lean over to the right. I spend hours every day in horrible biomechanics. So does that mean I'm doomed? I'm 50. I feel pretty darn good. Why? Well, I have 3 other chiropractors in my office. I practice what I preach. I get aligned on a regular basis. I do try to have good lifestyle choices in hydration and food. So, a non-inflammatory diet that goes a long way. So we're patterns of what we do. Those patterns affect biomechanics. Some patterns are changeable. Some patterns aren't. Okay. Pattern is changeable. If you're that person that is on a computer all day and you use a laptop, it's impossible to have good ergonomics with a laptop. You are either choosing to have the laptop higher so the ergonomics is good for your eyesight and your neck, and now you're up like here typing with your hands too high, bad ergonomics for your shoulders, wrists, elbows. Or if it's good ergonomics for the hands, well, now you're looking down. So that might be a person who should not use a laptop, should have a desktop with a monitor so they can get that ergonomics down. Going a step further, sitting static postures are terrible. I don't care if it's standing or sitting. Both of them are bad if they're static. Our bodies need movement. Movement is what nourishes our joints. That's how synovial fluid brings in nutrients to joints and helps them stay healthy. So those
Right.
Vario desks are great. I try to stand most of the time at my desk, and I stand on a wobble board. I have this thick foam pad. It's to help people with balance. So you stand on it, and it's just a foam pad. It's uneven. It smashes. You have to work really hard to stay upright, and I'll stand on that. So the whole time I was like, even though I'm standing still, my body is in constant fluctuation to adjust for that.
So constant movement and not getting stuck in that same position over and over. And
Yeah.
you're right. I mean, a lot of us, especially a lot of people work from home, and you have a lot of your weird postures when you can be by yourself, to your point. But what you're saying is keep that flow and work on that alignment.
Yeah, but first
Good.
and foremost is to have the good the good ergonomics when possible. And what I really wanted to get across too is sometimes good ergonomics just aren't possible. So change the
Right.
things we can, accept the things we can't, and do things to minimize the effects that those bad patterns will have.
That makes sense. So, can you talk a little bit more you've talked about some of the posture and so forth, which that could be a segment all on its own. Thanks for the tip with the cell phone. That was great. If you've missed that, go back at the beginning and hear that, because that would be great, because we all like this. So that was a great tip. Is there anything for your patients over the years that you have a flow from a conservative aspect to, promote healthy inflammatory responses, movement, supplements, and so forth? What do you usually do for that?
Absolutely. Obviously, my go-to is the one TDC. I've 20 some years I've been in practice, and I luckily found this somewhere around 15 years ago. Haven't never looked back. I don't use other products. I don't say bad things about other products. They all work, but this product works differently. It's my go-to to reduce the inflammatory response in my patients, to promote a healthy inflammatory response. That's the most profound thing I've found. I have had patients that were on prescription NSAIDs, and they were able to get off of them because that worked as well as the prescription NSAIDs.
Right.
And I found about
we're not making claims here. I just want to be careful on that.
no. I'm stating
your experience.
my experiences. Patients that were on over the counter or prescription NSAIDs have been able to get off of those or take less of them because of how well the product works. And nothing works for everybody. And I've
Right.
seen it in my practice. I tell my patients right off the bat, this works on 80% of the people. Please grab some samples on your way out. If you're in the 20th percentile, you're going to come back and say, hey, it really didn't do anything. But if you're in the 80th percentile, it'll be one of your best friends if you have chronic pain.
It is a good percentage. I think that's important for people to know that, because people often ask about 1-TDC. They know what it does for the animal side, but they wonder for themselves. I think what's really important to understand is that cream that Dr. Kelly was showing, that's on our worksowell.com website, is what's different about that cream is it actually goes right through the skin, subcutaneous. So it really goes very deep into the tissues, the joints, the muscles, tendons, ligaments, and it promotes very, very healthy inflammatory responses, which is a nice way to combat the discomfort. And if you just join, actually, you're probably seeing down below, if you know about the 1-TDC for your pets, try it for yourself. You're going to be amazed. And we have such a great offer, which is unique to this segment, actually. If you go to worksowell.com, use in your checkout the code STRONG15 when you buy the bundle of 4 90 count 1-TDC, and plus you get a free cream with it. So you can't beat that. So if you're already using it, take advantage of it. We thank you for your loyalty. But that's definitely something that Dr. Kelly himself used.
Yeah.
Actually, you have a great story about that, how you actually even came to become a chief medical officer.
Absolutely. But I want to go over one thing that you brought up, because we do know from the research that over 95% of the active ingredient in 1-TDC does have full transdermal absorption. And that's why I say it works better than other products. Other products, if they cannot get through all layers of the skin, they're not getting to the joint, muscles, tissues. They're not getting to the areas that are actually injured or inflamed. So that's why it works so well. It gets to the areas that need healing. Some of the other products work on the pain gate theory, which means it creates a sensation on the skin. The nerves can only carry, just like our home electrical wires, they can only carry so many signals. So if you tell them they have to carry cooling or heat or tingling along with pain, they will carry less pain signals. So essentially, you will feel less pain, but it hasn't changed your condition. I think 1-TDC actually has an opportunity to change your condition, and that's why it's my go-to.
Got it. Well, that's
now. What did you ask me? Because I forgot the question.
Well, it was really your conservative product. Obviously, as a chiropractor, I'm sure that, and that was huge when you talked about the alignment part of it, and that, if a joint is misaligned and you're working and overusing it, then you're going to lead to having inflammation. So obviously, as a chiropractor, that's your expertise, is to keep the with the help. Oh, we have a question actually before I go there by Cindy. Thanks, Cindy, for the question. If anybody else has questions, please don't hesitate. She asked, does it help, I assume, the 1-TDC cream and the 1-TDC supplement with neuropathy, is the question. It's a great question.
That is a great question. It is a difficult question because it is a difficult condition. When it comes to my neuropathy patients, I simply tell them to try it. There's no side effects. It's inexpensive. And I do want to go back to talk about some of the other type of conservative treatments or less conservative treatments as well. But compared to some other conservative treatments, it's inexpensive for what you get. Like I have patients come in all the time and saying, hey, should I try this CBD cream? And I was like, you can, but did you try 1-TDC? Because it's a quarter of the price. If you have something that works fantastic at a quarter of the price, why spend the other 3/4 of the money? So I always tell them, have TDC fail again. Let's look at really simple solutions that work, and when they fail, escalate up. So CBD is great, but if you could get the same effect for less price, do that. CBD doesn't, or 1-TDC doesn't work, escalate to CBD cream or oral. So there's lots of options when it comes to that kind of stuff. So back to the neuropathy, I would just urge you to try it. I've had patients personally who it did help, and I've had patients that it didn't even touch it. It's just a tough one, and that goes along with a lot of treatments. I have a friend who he specializes in treatment of neuropathy, and he has all kinds of modalities. And he does great things for people, but it's not like the person who comes in with neck pain. I could count on one hand how many people a year I don't help that comes in with mechanical neck pain. It's just a tough one.
Yeah, thank you for that, Cindy. Thank you for the question. So, bottom line, you may want to take advantage of the Strong 15. Get your combo of 4 bottles. Definitely do a loading dose is what I would encourage you. So you'll go through 2 bottles for the first month. And the whole thing, if you're in the USA, you still get free shipping with it. So it's a really good deal. It's like $102. I think you get 4 bottles and you get one of the 2-ounce creams. So take advantage of it, Cindy, and give us some feedback. See if it's helping you. And hopefully, if it's for yourself or somebody else, we really sincerely hope that it will help. Do you want to cover some of you were going to go in a bit more depth about some of your conservative treatments that you do as well in tackling arthritis?
Yeah, I do a lot of deep tissue work, trigger point therapy. Again, you're working on biomechanics. That's why I do it. Adjustments, fix biomechanics, but I always say we're belts and pulleys. And if you have a bad pulley, it's going to affect the belt. If you have a bad belt, it's going to affect the pulley. So yeah, I address the joint not as 2 bones in alignment or out of alignment or not functioning, but I address the things that move those as well. I think it goes a long way, and a very simple way to understand is if you took a bungee cord and tied it in a knot, that bungee cord is not going to be as long. It is not going to have the same stretchiness as one that does not have a knot in it. So I always explain those knots are trigger points and myofascial adhesions that we get between muscles. And it does change function. It changes biomechanics. You could have a perfectly healthy joint, but if you have trigger points that have changed the muscle's length, it's putting pressure on those joints that it doesn't have to if you get rid of those trigger points.
So what you're saying is, sorry, Dr. Kelly. So what you're saying is, from an alignment standpoint and from a biomechanics standpoint, you're not just aligning this. I mean, you are aligning the spine, but you're also focused on the myofascia and the trigger points. Can you explain a little bit more of what that means? Because not everybody knows what myofascia is to begin with, and what does that mean, trigger points, and how does that relate to the biomechanic? Can you kind of very quick synopsis explain what that means and how that obviously relates to your point with arthritis?
Yeah. So easy understanding of a trigger point or a muscle that's tighter than it should be is the bungee cord. If you attach that bungee cord to 2 things with a knot in it, it will pull harder on both sides of the bungee cord than one that's longer. That's what trigger points do. That's what muscle spasms do. They pull harder at each end, which now you're starting to affect joint mobility. You're starting to how hard the joints are actually pulled together. So when it comes to myofascial adhesions, which are different animals, I always explain myofascia as, did you ever see the fresh chicken breast? It has that white shiny stuff over it that is just so hard to get off and get rid of.
Right.
That's the fascia. All of our muscles are the bellies of the muscles are encapsulated in fascia, that white, shiny, hard stuff. I shouldn't say hard stuff, but tough stuff.
Right.
That encapsulates our muscles. So the easiest way to understand that is if I took a dab of glue and I put it on my hand, and that's the muscle, and here's the fascia, it should slide all over it. But I have a spot where that fascia cannot move because it is attached to that muscle in a way it shouldn't be. That has just changed the biomechanics of that muscle and that mobility of the joint, because if that muscle needs to slide under that fascia, it can't. It's changed the biomechanics. So that's why there's the fascial system is they're almost like latest research shows that they're considering it its own organ system. So it's very profound, and it's relatively new thinking, and I don't think we've hit the tip of the iceberg on what our myofascial system actually does.
So for everyone that's listening to this, if you have a suspicion of arthritis, any suspicion of biomechanic that needs some help, find someone that knows how to do trigger point work and specifically, I guess, releasing that myofascia, which is huge. The same thing, actually, a lot of my friends that are in the dog sports and rehab environment, that's actually what they're doing as well. They're helping a lot
Yeah.
of the dogs and the athletes on that note.
And just to put a little disclaimer out there, I tell my patients who have been to another chiropractor, and they say, "Well, you treat so different." I always say, you go to 20 chiropractors and you will get 20 different treatments, and they all work. You just have to find the one that meshes with your body and your conditions and their treatment style. And it goes the same for PT. You could go to a lot of different PTs and get very subtly different treatments. So, keep that in mind. You need to find the practitioner that is working with you in the way your body needs.
And I got to tell you, because I've also worked a lot with chiropractors, and some of them have magic hands. And I get to go through school to get certified and so forth. But you've actually personally worked on these, so I can attest to your magic hands. But I think that's what I really have appreciated about you, is that you're not just cracking bones. You're really looking at the alignment, and you're looking at the structure of the fascia and the whole biomechanic, which I think makes a huge difference. But I need to ask you something else too, because when we think of arthritis and the different types of arthritis, there's always a concern of side effects. So can you talk about that? Is there anything that you've seen in your 20 years plus of experience working with patients? Is there anything to be on the lookout for from a treatment side effects perspective when it comes to arthritis?
Yeah, I mean, really, most of the treatments that are out there that are going to have the side effects, it's going to be the medications. Whether it be the person managing with overdoses of over-the-counter NSAIDs, just taking high doses, way more than they should, on over a long period of time. A lot of side effects: kidney, liver, stomach. There can be serious issues as the prolonged overuse goes on with those type of drugs. If it's a serious condition, it's prescription, they get exponentially worse. Rheumatoid arthritis, it's terrible. The drugs are terrible, but the condition's terrible. And that's when, as I said, you start with the stuff with little side effects that help people. As they fail, you escalate, and sometimes that escalation also means you're making a choice between side effects and pain.
So you're saying there's a balance. Would you do the drugs in conjunction with some of the conservative treatment that you're talking about? From a comfort, promoting healthy inflammatory with 1-TDC cream and the supplement, all of the treatments, body work that you're talking about, can they safely be done in conjunction with each other?
Absolutely, and I obviously recommend that. What we do, again, I'm your mechanic. The more in line I can keep you, the less likely you are to accelerate you wearing out. So we never stop doing that. We never stop taking care of the body. And that differs for different people. You probably heard me say, you've seen a car going down the road, smoking, making more noises than you can even imagine. You're like, how's that thing even run? And that's how our body is. Like, we run when we're that car that's smoking and making all kinds of crazy noises. Very little maintenance was done on that car, but it's still getting somebody.
Still running. Yeah.
Now, or you could be an F1 car where they tear down that engine and rebuild it after each race. Obviously that's the extremes, but we are somewhere in between. And where do we want our bodies to be, and how do we want to maintain it goes a long way.
All right. So as we're wrapping down here and talking about arthritis, and we've talked about the treatment plans, side effects, and more importantly, also the biomechanics and the impact of that, of any disruption in your biomechanics. I just love the way that you talked about the overuse is not necessarily leading to arthritis, but it's, if you misalign, that could have a huge impact. So for all the youngsters that are out there, or middle agers like us, or even older, that are doing everything that they can arthritis be prevented?
In most cases, yes.
Okay.
And when I say in most cases, There's always exceptions. I try to train my kids, don't use the word always, never, because they're probably very rarely true. There's always
Right.
exceptions. And when it comes to arthritis, there's exceptions. If you have a genetic predisposition, which genetic is sometimes unavoidable, you have to combine nature and nurture. But when you're talking about genetics, there is a predisposition for rheumatoid arthritis. So if that genetic predisposition is there, and you may not be able to
Do
stop it.
something.
It just might happen. Trying to do everything right, and it still happens. But I would say that for the most part, if you're reducing systemic inflammation, even people with RA, it helps. So maybe, yeah, you got it, but maybe it's a tenth of what it could have been if you weren't taking care of yourself.
Got it.
So yes, it is preventable, not always.
All right. So as we wrap up, if you could give us your key tips in tackling proactively arthritis, or if you already have arthritis, if we're narrowed it down to the bottom line, what do we need to know?
Number one, always lifestyle. You got to stay hydrated. You got to have a healthy diet, a non-inflammatory diet. You need to exercise. You need to move. Our joints do not have a blood supply. They have synovial fluid. And how do you get synovial fluid to give nutrients to the joint? By motion. So I always tell my patients, if you quit moving, you're going to rust. So keep moving. So diet, exercise, hydration, working on your biomechanics. Lifestyle encompasses all the good stuff that we should do. And you do the ones you can, the ones you can't, you try to manage. Two would be, we are patterns of what we do. Change those patterns. Stop looking straight down at your cell phone. 25 years ago, I should have stood on the right side of the table sometimes, and tried to make that a pattern that I did 1 week on one side, one on the other. And yes, I did try to do that when I was fresh out of practice. And there was a change I couldn't overcome. I'm right-handed. I wanted to be on that. I wanted to use my right hand more than the other. So you change the things you can, and you accept the ones you can't, and you manage them. And the last thing I would say is, if you live long enough, you're probably going to get it, because we can't manage all of our patterns. So you got it. Does that mean you're in pain for the rest of your life? And the answer is no. This is the biggest takeaway I want people to understand. I've taken too many patients' x-rays and see x-ray, like a horrible x-ray, arthritis out the wazoo. And they're like, oh, so I just have arthritis. I'm going to have to live with this. And the answer is no, because you came in because you hurt yourself yesterday. So before yesterday, did you feel great? Yeah, I felt pretty good. I was very active. Well, you've had that for 20 years. That arthritis started 20 years ago, not 2 days ago. So you can live pain-free even though you're in that much arthritic state. So that's what I want patients to understand. Having it doesn't mean you're doomed. There's a lot of things, like you can get into depression. And the reason I bring depression up is, if you are in a depressed state and your body releases cortisol because you're in a long-term depressed state, it changes your pain thresholds. So psychologically, you can do things that put you in more pain. But it also goes to physiological. So if you just trash your body and put stuff in it that makes your body inflammatory, yes, your arthritis can feel worse because you are now in an inflammatory state. You're like aiding and abetting the levels of arthritis that you have. You clean yourself up, you clean your act up, you can actually have pain-free or less pain from the same amount of arthritis. So no, having it does not mean you live with it for the rest of your life.
Yeah, that's a good recap, and you're going really into the last really important segment. So it might be there, you might have some pain, but there's a lot of things you can do for it, and I think that's very, very encouraging. So I'm going to remember my tip and looking at the phone up, so I don't put my neck down. that'll be Dr. Kelly's reminder throughout the day, because unfortunately we tend to be too often on that piece of equipment. The hydrating, yeah, that's a no-brainer. The food,
Yeah.
That's really key. And keep moving, stay mobile. I think that's really, really, really important. Um, Dr. Kelly, I really thank you for your wisdom and knowledge on explaining to us what is arthritis. And now if you've just joined now, please go back and watch this segment. There's a lot of information that you're going to learn here, and I think I'm going to probably want to bring you back and talk about posture, because I think that's something that we need some tips to do a better job at. And if you've got some questions of things that you want to bring Dr. Kelly for specifically, we'll be happy to look at those comments and then schedule them in the future. But posture, I know that's a big one, and keep moving. I think that's something we can definitely help. And I love the stuff you talked about, myofascia and release. That's a whole science in its own.
Yeah, I tell you what, posture, people, when I tell them about biomechanics and they say, so I need better posture, and they try to sit up straight, and I said, don't do that. Your back will be burning in 30 seconds by forcing yourself to have good posture. It's a process, and it is not a process that happens overnight to get bad posture, and it is not a process that happens overnight to change that posture, because you can absolutely have positive effects on posture.
Well, that would be a good next show for us, just to talk about that posture and in all of those details. Dr. Kelly, thank you so much for your time. I hope you enjoyed this. If you're watching it live, great. Thank you for being here. And if you're watching it now and it's not live, that's great. Take advantage of the 1TDC Strong 15 coupon code that you have, 15% off. Get the bundle of 490 count, and you get a free cream with it too. So take advantage of that while it's still up. Thank you, everyone, for joining. Dr. Kelly, again,
Yeah,
thank you.
Thank you very much. I had a great time with you, Olivier.
Take care.
Bye.